Hi, I am Dr. Arsalan and today we are going to discuss a sexually transmitted disease, the syphilis. It may be defined as it is a sexually transmitted disease caused by bacterium characterized by red painless lesions formed on the genitalia. Syphilis is a sexually transmitted disease. It is also called as STD, sexually transmitted disease, or STI, sexually transmitted infection, or venereal disease. So all these terms refer to the syphilis, the STD, sexually transmitted disease, STI, sexually transmitted infection, or venereal disease. It is caused by a bacterium and characterized by red painless lesions. These lesions are called chancres. These lesions are usually found on the genitalia. Syphilis is caused by a bacteria Treponema pallidum. It is gram-negative bacteria, spiral-shaped and highly motile. It's very important to know about the transmission of the syphilis. It can be transmitted through two routes, the vertical route as well as horizontal route. Vertical route refers to the transmission of the infection from parents to offspring. Usually the syphilis is transmitted from the infected mother to the offspring and it causes stillbirth. The offspring born is usually dead. The horizontal transmission may be of two types. One is through sexual intercourse with the infected partner, and it is the most common route of infection of syphilis. Second, the abraded skin. The bacteria can also pass through abraded skins or wounds. So these are the two routes of transmission of syphilis, vertical as well as the horizontal. Incubation period of the disease is 2 to 3 weeks. It means that when the bacteria is innervated or penetrated in the abraded skin or it is transmitted through a sexual contact, then the onset of infection will occur in 2 to 3 weeks. So this is the incubation period of the disease. Clinical signs of the syphilis disease are ranked in the 4 stages: the primary stage, secondary stage, tertiary stage and latent stage. In the primary stage, primary lesions of the syphilis appear. Primary lesions of the syphilis appear in the primary stage. These lesions are called chancres. These are the characteristic lesions of the syphilis disease. These chancres appear on the genitalia and mouth of the infected person. Chancres are non-itchy, red and painless lesions which appear on the infected parts of the body. For example, these appear on the genitalia and mouth of the infected person. In case of males, the lesions appear on the scrotum, penis, anus, rectum, and these are quite visible, while in case of females, the lesions are interior. These appear in the cervix and vagina and are invisible. These lesions go unnoticed in the females. So these are the primary lesions of the syphilis. These chancres last for few weeks and spontaneously these heal up. These are converted into crusty layers and are dried off and shed from the body. In some cases, if the disease is left untreated, it is converted to secondary stage, in which the signs appear like body rash, the fever, joint pain, lymph node swelling. These lesions again disappear in 2 to 3 months. But if these lesions, the secondary lesions again, these are complicated or infected by other bacteria, so these will convert into the tertiary stage. It is the fatal stage and is dangerous because there are gammas production in this tertiary stage. Gammas means the destruction of central nervous system. Moreover, the other vital organs like the blood vessels, heart, bones, skin, all these vital organs of the body are infected and damaged or destructed by this bacteria due to tertiary stage. So this is a fatal stage. In some cases, the disease runs in the latent stage, in which there are no apparent clinical signs and symptoms or chancre formation. The primary and secondary lesions are absent in the body. Still the bacteria is present. So this latent stage, in which there is no clinical signs, the person serves as carrier and it can transmit the infection to the healthy partners via sexual abuse, and this stage lasts for lifelong. So lifelong the person is carrier and he can transmit this infection to other partners. Beyond the inapparent phase, still the disease can be diagnosed by the blood test. In case of latent stage, the blood diagnosis is a fundamental tool. Blood diagnosis tool is the fundamental tool for diagnosis of latent stage. The bacteria is present in his blood and he is the carrier of the disease or not. Now we come to the treatment of the syphilis. Penicillin is still the drug of choice for syphilis, but it is recommended that the injectables must be used. The penicillin injections are available, and the most effective injection of penicillin is Calamox. It is in combination of both penicillin, the amoxicillin, and clavulanic acid. So Calamox injection is recommended for the treatment of syphilis, and single dose or single shot is enough. So this was all about the syphilis. The syphilis disease can be prevented through protective sex or being the monogamous, that the sexual intercourse with the different partners or infected partners must be avoided in order to get rid of this syphilis infection, because it is fatal and sometimes it enters the latent stage in which bacteria is present in the body lifelong, and the person may transmit disease to the healthy partners